depression. So we know that people with cancer experience the full range of psychological issues as anyone else would. This includes depression, anxiety, that can be general anxiety disorder or a panic or a phobia. There's certainly substance abuse disorders that people have because they bring that with them to the cancer experience. People may have cognitive problems even before they start chemotherapy. People come to us with psychotic disorders and personality disorders. I'm going to focus more, as I said, on depression today, not necessarily a formal diagnosis of depression, but just the experience of depressive symptoms. We also know that distress tends to come at somewhat predictable points in the trajectory of being diagnosed and treated for cancer. And this is all kinds of cancer, not just specific to MEN. Certainly diagnosis is a really, that's a really first exposure. And we know people are very highly distressed, usually on average for the first couple weeks after they hear you have cancer. That's obviously, it's one of the most feared diagnoses people can get. Even when they have a very manageable cancer, it's still one that provokes the most anxiety and fear. As people move into treatment, whether it's surgery, radiation, chemotherapy, whatever it might be, that can be very anxiety provoking. People wonder, will it work? Are they giving me enough of it? How am I going to react? And how am I going to react from week to week? Because sometimes it's not predictable as people go through treatment. There could be pain, there could be other unpleasant side effects of treatment. And so all of those require that people figure out a way to deal with all of that and all of the uncertainty that surrounds them. And what some people may find surprising is that when people stop treatment, that can also be a period of high anxiety. People start wondering if it's going to work, if the cancer is going to come back, did they give me enough? And for the first time, they're not actively doing something about their cancer. And so that can be a very anxiety-provoking time as they, even if they go into remission, as some of you may have already experienced, your sense of invincibility, your sense of vulnerability has been destroyed. We get up every morning and think we can go about our day and we're going to be fine, and a diagnosis of cancer tends to take that away from people. Certainly, if there's a recurrence of cancer, that's a high anxiety time, and when people need to face moving into palliative care. Survivorship itself, even when people have a very long life afterwards, that carries with it a whole number of concerns that are very different from the earlier phases of cancer treatment. And there are a number of other factors that can contribute to distress and depression. Certainly, sometimes the type of cancer, the cancer stage, the prognosis someone has, and when that changes, and where a person is in the cancer trajectory, which I just reviewed. And then, as I mentioned, everyone brings a whole life history and personality to the experience of cancer. So if someone has had psychological issues in the past, they are probably at higher risk for having them again, because cancer and its treatment is a stressor, sometimes a huge stressor. And that can put people at risk for re-experiencing some of these same problems. People bring different personalities, different coping styles, some of them helpful, some of them not so helpful. And then it also depends on what kind of support system they have. One thing we see a lot is we see, for lack of a better word, I'll refer to the patient as the person with cancer. We see patients protecting their families and families protecting the patient. And sometimes this means that no one's really talking to each other about some of the really important things. We also see patients not wanting to burden their friends and their family, and so they're marching through this alone when they don't necessarily need to be. I want to briefly go over some of the symptoms we look for in depression. And again, I'm not necessarily talking about a clinical diagnosis of a major depressive disorder, but just depressive symptoms. Two of the key symptoms are sadness for most of the day, nearly every day. Typically, we want to see this, we don't want to, but we look for this going on for about 2 weeks. And a loss of interest in things, or the inability to derive pleasure from the things that you used to enjoy doing. Not because you can't do them physically, but you just don't want to anymore. You don't want to talk to your friend, you don't want to read the book, you don't want to go to the movies, whatever it might be. We sometimes see an increase in a sense of guilt, even when there's no reason for that guilt, a sense of worthlessness, hopelessness, lack of energy, difficulty with concentration. It can be an increase or a decrease in appetite. Sometimes there's a sense of sluggishness. It takes a whole lot to just get going. On the other hand, sometimes people feel really energized and not necessarily in a good way, where they just can't really calm down. Sleeping more or less than normal, loss of interest in sex, and thoughts about maybe, I'm not sure my life is worth living anymore. Now, when I'm evaluating someone with cancer, the ones I focus on are what we call the affective symptoms, or the ones that are based in emotions and thoughts. And these are the ones that are in the box: the sadness, the loss of interest, guilt, worthlessness, hopelessness, and thoughts that maybe your life isn't worth living anymore. The others are what we refer to as somatic symptoms. And these, the reason we don't focus as much on these is because you can also have these as a result of having cancer and getting treated for your cancer. And so we don't discount them entirely, but I put less weight on those types of symptoms. And why does it matter? Well, for one thing, it's just not very fun to go through life feeling depressed. You don't cope as well. No one copes as well when they're feeling down, depressed, feeling blue. It can impair functioning. It makes it difficult to function physically. Depression can interfere with how we think. We're slow. We can't recall words. We can't remember things as well when we're depressed. It can interfere with people being able to follow a treatment plan. As I mentioned, it just reduces the quality of life. Why would you want to go through life feeling distressed if you didn't have to? And it can actually exacerbate physical symptoms. People who are really severely depressed talk about the pain of depression. There is a physical pain that goes with it. We also know that people may experience, but certainly talk about having more physical symptoms when they're depressed. So when do you know that you should do something? In general, I don't think people need to wait until they believe they have some major depressive disorder going on. If your mood bothers you, then it's probably time to get help for it. If you're not sticking to your treatment plan, if you're just not on track with the things that you know that you're supposed to be doing, and you think maybe your mood's contributing to that. If you're not getting out of bed and you're able to do that, that's a sign. If you find yourself wanting to cocoon and stay at home or stay in bed, and that's not normal for you, and you're physically able to get out, that's something to pay attention to. If you're not taking care of yourself in the very basic ways, other people might be expressing concern about your mood. You may have less awareness of it in some cases. And as I mentioned before, certainly if you're questioning whether or not life is worth living, and if you have a personal or a family history of depression, then it's probably worth thinking about getting help. What kind of help is available? The first is psychotherapy, and I'm going to come back to that in a minute. The second is pharmacotherapy, getting antidepressant medication. There's some people who have very strong feelings about medication, pro or against. I think I probably know more against. They can be very effective. They're not, if anyone is, for those of you not familiar with it, it's a very subtle change. I tell people that it provides a safety net so that your lows don't go too low. But it's not a dramatic change. It's not going to change your personality. It doesn't give you euphoria. You may not even be aware that you're improving. I frequently see patients and say, well, how are you doing now? You've been on the medication for 2 or 3 months. I don't see any difference. Well, talk to your spouse, talk to your family, and ask them. They'll come in the next time and say, well, my wife actually thinks she sees a pretty big difference. So it's a very gradual and subtle change. It can be worth considering. Certainly anything that reduces your stress levels can help, and what works for you may not work for anyone else. It's just important to find what it is that helps you, whether it's meditation, relaxation exercises, guided imagery. It might be classical music or jazz. It may be going for a run, doing art, whatever it is. And most importantly, seeking and accepting support. It's a really challenging time, and people, I find, are extremely reluctant to ask for help and to accept help when it's offered. So this is the time to really buck up and admit that you're dealing with a really big issue here. You need some help getting through it, and tell people how to help you. They frequently want to know, but they need some help from you to know what kind of help would be most beneficial. It can be helpful to find other people who have gone through similar things. Immerman's Angels is one organization that can help pair you up with someone else who's had cancer or going through cancer. It's important to stay as active as you can. I talked earlier about people may not want to leave the house, may not want to get out of bed, and I tell my patients, you have to stay active. Go out to dinner with your friends, go to the movie with friends, even if you don't want to, and even if you don't enjoy it. Enjoying it is not the point right now. You just have to keep putting yourself out there and staying active. Cancer comes with a lot of losses, even if you're going to live a very long life. As I mentioned, you've lost that sense of invincibility. There could be body integrity changes. There are a lot of different things that are different now. There's a different life, a new normal that you have to face. And sometimes you need to grieve those losses, just as you would grieving the loss of a person. Think about the biggest challenge you faced in your life and how you got through it. And if you got through it well, those coping strategies that you used before may serve you well this time as well. It's important to listen to your body. Rest when you need to rest. Take in fluids. Pay attention to your doctors and your nurses, but your body will tell you what you need to be doing. Try to find meaningful activities and stay engaged. As I said, even if initially it's not fun, that's not the point, at least initially. Something I think we can all benefit from doing more is staying in the moment, being in the here and now instead of yesterday and tomorrow. This is where we are right now. This is what's under our control. And you may find that you need to educate others in terms of how to help you, what you're going through. Many people have talked to me about all the horrible things that people have said to them, trying to be helpful, and they're terribly misguided, but they're well-meaning. So sometimes you just need to help your friends and your family understand what you're going through and what kinds of things they could say that would be helpful. And I've had patients say, well, it's not fair that in addition to all of this, I have to take on educating everybody else. Well, no, nothing about this is fair, but if it's going to help you, if you can get support more appropriately by doing that, then maybe it's worth doing. What not to do, keeping your feelings inside, blaming, criticizing yourself for feeling depressed, being embarrassed or ashamed to get help, resorting some of the unhealthy coping strategies. And for caregivers, I would say some of the biggest complaints I hear from patients are, people keep telling me I have to have a positive attitude. You know, they just don't understand. The research tells us that having a positive attitude is not going to make a difference in terms of how you survive, in whether or not you survive your cancer. It will make a difference in how you survive it, in your quality of life, how well you cope, and all of that. So think about how you deliver that message if you're a family member or a caregiver. I wanted to come back to psychotherapy. Many people don't have the experience of having seen a psychologist, and goodness knows Hollywood has not been kind to us. We're typically the buffoons in the movies and the TV shows. One thing it's not about couches. I've never worked in an office that has a couch. Sigmund Freud never comes up, at least in my sessions. We're not going to make you talk about your mom unless you want to talk about your mom, and then we will. Sadly, it does cost more than 5 cents. But what it is, I hope, is supportive. It's problem-focused. It tends to be shorter term and very practical. We want to get you through this experience of being diagnosed with cancer and treated for cancer. It's not about solving all the other problems in your life. There are other psychologists who can help you with that. But in health psychology, we're very focused on getting you through your illness experience. There's tremendous benefit in talking to an impartial third party who's not a friend and not a family member. We have no vested interest in what you choose to do and the decisions you make, and we're not judging you. Finally, a lot of the methods we use to help people in psychotherapy, especially health psychology, they're grounded in research. And so we know they work, and they've been put through the same types of clinical trials that drugs go through. And so it's very what we call evidence-based. And I wanted to end on a somewhat positive note. And the other thing that many people going through cancer tell us is that there can also be benefit from having gone through the experience. I don't know anyone who would choose to do it if they had the choice not to. But we do know from clinical experience and research that there's this thing called post-traumatic growth or benefit finding. People talk about looking at life differently, wanting to reevaluate priorities, developing closer relationships, having a renewed sense of what they're capable of dealing with. They tell me a lot. I didn't know I was strong enough to do this. I'm pretty amazed. And just overall having a greater appreciation for life. Just a brief word. I work part-time in supportive oncology, which is just 2 floors up from here in Suite 520 here in Prentice. And we have psychologists, social workers, a nurse navigator, we have nutritionists. So we have a range of support services available to you. In addition, we can connect you. Obviously, Cancer Connections happened earlier today, and we help sponsor that. There are Gilda's Club activities that happen here on this campus. Things like Look Good, Feel Better from the American Cancer Society. And we also have a strong program in adolescent and young adults. So just to let you know that there is support available, and some of those services are available both here at Prentice and over at Galter. And that's it.